Welcome to Adapting Class. This is our last series on Alzheimer's disease. High yield fat content you need to know, 10 questions. It will blow your mind. Stay back. Like I said, stop the video, answer the questions on your own, and listen to me later and see what I have for you. But this is to put everything together so that you will never miss any question on Alzheimer's disease. What do we have? Test taking strategy. Read the question from the back. The client was found in the next door client room eating what? Food. Which action the carer nurse should take. So what is the problem? A nurse cares for a client with what? Moderate Alzheimer's disease admitted for dehydration. The client was found in the next door client's room eating the client food. Which action the carer nurse should take at this time? Patient is being admitted to another place. You find the patient in another patient's room trying to eat the other client's food. Patient has moderate Alzheimer's disease. They usually confused. They wander around. They have anxiety. They may sound downing. All of this, you cannot negotiate with this patient. Restraining will make them more frustrated. Notifying the care provider does not fix the problem. Assist the client to the appropriate room. Yeah, this is not your room. This is your room. Redirection. Give them volume. It's going to make them confused. Test taking strategy. Go with the concept related to that disease process. This is more palatable. Okay. Next question. Which of the following intervention in the plan of care for a client with moderate Alzheimer's disease is a priority? Once again, in moderate Alzheimer's disease, they have problem with coping, right? They have like anxiety, neuropsychotic problem. They 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 forget to eat at all. They may have anorexia. That this is where the self-care deficits become more prominent. They wander around and sundown, right? What is your priority for a patient with moderate Alzheimer's? What should you do? Always don't memorize the answer. Look at the other answer choices and pick the one that makes sense. Ignore negative behaviors. I told you they're going to have negative behaviors. Redirect them. Don't ignore them. Limit client choices to activities of the day, right? They're going to have problem with daily activities. They will try figure out how to cope with all those things. Make sure the activities are a little bit limited so they have one choices to deal with and they will be fine. Orient the client to reality. They will never come back to reality. You can orient them to situation, but not to reality. Avoid validation technique during care. This is the best way to take care of them. You should validate their care and validate their feeling, and that will engage them in communication. Find out what is their problem and validate their concern. So limit client choices to activities of the day. The choices limited. And next, so let me show you the explanation. A cognitive function decline, clients will be frustrated on how to manage choices, and this will lead to agitation and confusion. The nurse should give limited choices. The nurse should use validation to find out what is causing the frustration. What is the nurse? What is the nurse best response? A nurse cares for a male client with early onset of Alzheimer's disease who accuses the nurse of starving him by refusing to provide breakfast despite eating 25 minutes ago. What is your best response? Remember, early onset. There's a reason why there's early onset. So early onset, they forget that if eating food at all. So you give them food, they forget. So the best way to do that is to basically keep on giving them small meal at a time. Don't give them a large meal so that that situation will not happen. If you give them food as they requested, they're going to continue to do that. You finish eating and you say, I did not eat, you don't give me food. So offer the requested meal as soon as possible is the wrong choice. Tell the client the next meal is scheduled an hour since he had already eaten. It's not going to fix it. You eat, you give them another food, it happen again. So the best time is to give them Best thing to do, give them small meal at a time so that this will never happen. Tell the client next time you will do better. You don't fixing the situation. The nurse is providing teaching to spouse of a client with moderate Alzheimer's disease regarding home safety. Which of the following the nurse should include? Home safety. They're going to wonder, they're going to fall, they're going to have problem, issues, right? Use leg restraint occasionally. Don't restrain them. Remove all throw drugs on the floor. Excellent. Arrange furniture so that they can move freely. Rubber, it's always good. On the hallway, in the bathroom. High toilet seat so that they don't have to go down all the way and fall down. Locks on the stairway so that they don't go down the stairs and fall down. Install door locks above and below their eye level so that they can see it so that they don't go outside and wander around. Install walk-in bathtubs. They don't have to jump over the bathtub, but they can walk in back and forth and take care of themselves. The only one you shouldn't do is restrain them. Which instruction the nurse should include when caring for a client with Alzheimer's disease? The same thing. You see, there's nothing there. The key word is Alzheimer's. So look at each other's choice and see if it's consistent with the patient with Alzheimer's disease and what you should do for them. Avoid rationalizing with the client. What do you think? Excellent. Don't rationalize with them. They don't have reality. Limit the number of choices to decrease client anxiety. That's the question we saw in number 1. Limit choices. Provide precise and concise instruction on one task at a time. One task. Provide cognitive stimulation to clients with simple activities and games, right? Cognitive stimulation. Stimulate them a little bit, but not too much. Look at the next answer choice. Provide a cognitively stimulating environment. You see, they are counteract each other. Watch for these kind of statements the NCLEX will give you. The idea is these people are losing their memory. If you challenge them cognitively, they get confused, they become anxious. That's why you cannot redirect them to reality. So E is saying that stimulate them non-stop, right? Provide an environment that is stimulating them. They will get confused, they won't remember. But D said, give them a cognitive stimulating client, provide cognitive stimulation to client with the simple activity, something small, so they can play with it, help with their brain. But don't give them an environment that they have to read a whole encyclopedia, right? No, something small. So E is wrong. Avoid too much activities that tax the client memory. You see what I did? D, E, and F. I put them there so that I can help you understand this concept. You can improve the memory, but not too much tax. That's why you should not give them too much stimulating environment. Does that make sense? And next, provide care for a client with moderate Alzheimer's disease. Which of the following the nurse should prioritize? The same thing. Perform activity of daily living for the client. Don't do it for them. Let them do it until they need help as needed intervention. Assist with bowel and bladder continence by scheduling toileting. Moderate Alzheimer's disease, what is the problem? They lose ability to self-care. So they will not be able to take care of themselves, cleaning themselves. Therefore, this is your key. You assist them with that. You don't do it for that. Instruct the client using 2 to 3 steps at a time, 1 step at a time, not 2 to 3. Provide cognitive stimulating training. That is why I keep on hitting on that question so that you don't get trapped. Don't do that. This is your right answer. A spouse of a client with moderate Alzheimer's disease told the nurse, I am tired and neglecting my own needs while caring for my spouse. Which nurse intervention is appropriate? Select or apply. So the spouse said, I'm tired. I'm not even taking care of myself while I'm taking care of this patient. Well, how should you think the nurse should respond? Respite care is for the caregiver. Recommend family meeting to solicit help from other family members. Yeah, not you alone should go through this. Let other members come and help. Recommend institutionalization in the nursing home. No, you don't need to send this patient to a nursing home. He said he's worried about taking care of himself. So taking the mother or the spouse to nursing home is not going to help the situation. Attacks the question they've asked you. How do you fix the idea that he or she is being overwhelmed? Sending the client to a nursing home would not prevent that. Recommend referral for counseling to help cope with the situation. Yes. Assess the spouse insight, figure out what she means by difficulty taking care of the patient. And tell the spouse things will get better. That's wrong. It's not going to get better. It's going to get worse as they progress from mild, moderate to severe. A client with moderate Alzheimer's disease told the nurse that this place feels like a jail for me. Can you get me out of here? What is the nurse's best response? Therapeutic communication. Answer the question. Don't pass the bag. Directly fix the problem. Everybody feels the same that way. I'm not everybody. Answer my question. Why do you feel the need to leave this place? Why is never a true answer? Tell me more. What makes you feel you are in jail? Asking for more information to clarify. Prison is worse than this place. You should be grateful. Who knows that? Don't say that to the patient. Answer the patient question. Number 3 is your best answer. The nurse cares for a client who frequently wanders around. Which intervention from the nurse is appropriate? Buzzword. Patient wanders around. That is the key. Focus on that. Wanders around. I need to prevent wandering. Restrain the client will make the patient more anxious. Supervise activity that promote walking. Yeah, supervise them as they walk. So they wander around, but you supervise. Create an activity that will make them as if they're wandering, but they're walking around. Allow wandering at selected time is not a good idea. They're going to wander anyway. If you give them 2 o'clock, you walk, and then 1 o'clock they get up, they will do the same thing. Place the client near an institute station is not going to prevent wandering. So allowing wandering at a certain time will not prevent them to wander on their own. But if you create an activity that will cause them to walk, they will think they're wandering. And the last question. Which of the following the nurse should assess? A nurse provide care for a client with moderate Alzheimer's. The nurse receives an order to perform mental status examination on the client. What do you think you should do? Mental status, you want to know how they're thinking, right? You want to know how they affect. You want to know what is their perception of life, how they see things, whether they're going to hurt themselves, and what is their speech. These are the components of mini mental status exams. Adapting class, thank you for the series of Alzheimer's. Good luck. Take care of yourself. Bye.